Okay. Dispensing station just-in-time training. Upon arrival to the pod, each person will be given a head of household form to complete. Per our plan, the person may fill out as many head of household forms as they have the necessary information on them. You must give a copy of the head of household form to each person to review. Identification is not required. County residency is not required. The head of household form must be filled out with the name, address, phone number, age, birth date, and weight if they are under 90 pounds, and several medical questions for each person whose medication is being picked up. Once the screener reviews and determines, based on the information on the form, which medication for each person listed on the form is to receive, you will take the form and dispense the correct medication for each individual as listed on the form. The screener will have indicated which medication is to be dispensed to each individual listed on the form. Make sure to double check the screener's medication decision to ensure its accuracy. When dispensing medication, you must write the correct name of the individual on a post-it note using a permanent marker or Sharpie, writing clearly and legibly, and place it on the bottle. Do not write or mark on the bottles. Bottles must be kept in the original condition they are received in for exercise purposes. Explain to the individual who is collecting medication that each bottle will have the corresponding individual's names on their bottle. Do not cover up any medication bottle information with the permanent marker. Be sure that people have their medication information sheets and answer any questions that they may have. Complete the head of household forms by correctly indicating which medication was dispensed to each individual by either writing the medication identification information or adhering the medication bottle sticker to the head of household form in the area indicated on the form itself. Date and initial the head of household form where indicated. Give the completed head of household form to the volunteer that is accompanying the individual being timed. These forms will be retained on file at the health department after this incident. As a dispenser, you are responsible for proper dispensing of medication or administration of vaccine and screening for contradictions. Maintaining communication with your immediate supervisor. Educational materials about the medical form being used, the agent, the medication being dispensed, and potential side effects of medication. Upon your arrival, you should review your position checklist and check off tasks as they are completed. Attend the overall staff briefing and familiarize self with the pod layout and process. Report to your assigned pod area for observation before beginning duties as needed. Familiarize self with all forms as needed. Introduce self and explain professional role and responsibilities to other staff members in the physical area. Familiarize self with location of your supervisor. Review educational materials on medications, becoming familiar with appropriate administration techniques, contraindications, potential drug interactions, medication and vaccine side effects, and disease symptoms. Meet with medical screeners. Familiarize self with the pod layout and process. And during on-site operations, you should review the recipient's paperwork, document that the vaccine or a pill was administered on the client forms, collect completed forms if necessary. Upon deactivation phase, participate in scheduled debriefing at the end of shift or close of exercise. Return to workforce staging area to return identification. Identify issues for the after action report. Thank you for watching this just-in-time training video for the point of dispensing dispenser position. If you have any additional questions, please ask your training supervisor once you are released to your station.